In this video, we cover how to conduct a rapid HIV test using a whole blood finger stick sample. Testing sites can choose from multiple CLIA-waived FDA-approved rapid HIV test brands on the market in the United States, and these tests each follow the same 4 general tasks. We prepare the workstation, collect the client sample, develop the results, and properly dispose of the used test kit and materials. In this video, we will look at these 4 tasks using a rapid HIV test called the ALIR Determine HIV-1-2 AG-AB Combo Test. Use of trade names and commercial sources is for identification only and does not imply endorsement by the Centers for Disease Control and Prevention. For specific instructions on each test brand, review the manufacturer's insert. Begin by setting up your workspace with the items not included in the test kit. For the ALIR Determine test, this will include cotton gauze, alcohol swabs, a lancet, an absorbent pad, disposable gloves, disinfectant wipes or 10% bleach solution, hand sanitizer, a biohazard bag, a sharps bin, a trash bag, bandages, a thermometer, and a timer. Put on disposable gloves and lay out the test kit materials on your workspace. The test kit contains an aluminum pouch with test strips, chase buffer, a quick reference card, information notices, a customer letter, disposable capillary tubes, and disposable workstations. These workstations hold the test strip. Open the aluminum pouch containing the test strips. Feel for an absorbent packet inside the pouch. If the absorbent packet is missing, discard the test strips and start over with a new pouch of test strips. If the absorbent packet is present, remove a card of test strips from the aluminum pouch. Carefully tear off a test strip from the right side of the card so that the lot number printed on the leftmost strip remains intact. Return the rest of the test strips to the pouch and close the pouch using the Ziploc. Remove the covering of the test strip and place the strip flat inside one of the disposable workstations. Avoid touching the sample pad on the test strip. Once you've prepared your workstation, you can collect the sample. To collect the sample, ask the client which hand they prefer, and then massage the client's middle or ring finger on their preferred hand in a downward motion multiple times to encourage blood flow to the area. Use an alcohol swab to clean the top of the finger and allow the finger to dry, either naturally or with sterile gauze. Uncap the lancet and rest it at the top of the client's finger slightly off from the center. Press down on the lancet to puncture the client's finger and wipe away the first drop of blood with sterile cotton gauze, disposing of it in the biohazard bag. If necessary, squeeze down the length of the finger up to the top joint and stop before the fingertip to encourage more blood flow. Collect the second drop of blood by holding the capillary tube horizontally and touch the tip of the capillary tube to the blood sample. Maintain this position until the flow of the sample has reached the fill line and stop. Fill the disposable capillary tube to the line to ensure the correct amount of sample. Watch carefully while filling the disposable capillary tube as the sample needs to come to that line exactly. Not enough blood or too much blood could result in an invalid test. If you overfill the disposable capillary tube, discard the tube in the biohazard bag and start again with a new tube. Note, some rapid HIV testers mistake the capillary tube for a pipette, but there's a difference between these two. The disposable capillary tube is used for a finger stick sample. The pipette is a similar tool, however it is larger and is used to take blood out of a vial or test tube from a venous blood sample. When you've collected the sample in the disposable capillary tube, place cotton gauze at the finger stick site and ask the client to hold it firmly against their finger. You will continue with the test and touch the tip of the tube to the sample area to deposit the blood onto the test strip. Do not lift the capillary tube from the sample pad before all the blood has been transferred. If a sample won't expel, Cover the small opening at the mark of the capillary with a gloved finger. Then squeeze the bulb until the sample is fully dispensed onto the sample pad. After you place the blood in the sample area, set the timer to 1 minute. Once the timer beeps, add 1 drop of chase buffer. Refer to the test instructions to determine how long it takes to develop the test. For this test, set the timer for 20 minutes. Now, you have time to bandage your client's finger. Read the results between 20 to 30 minutes after you've added the chase buffer. To read the results, look for a line in the control area. This shows the test works correctly. Now, look for an antibody test line in the lower test area. A line in the antibody test area indicates an antibody reactive result. Then look for an antigen test line in the upper test area. A line in the antigen test area indicates an antigen reactive test result. If a line appears in either the upper test area or the lower test area, it's a preliminary positive result. All preliminary positive results should be confirmed with a follow-up test. No line in either of the test areas indicates a non-reactive result and indicates that HIV antibodies and antigen were not found in the sample. A non-reactive or negative result reliably shows the client's HIV status as of 90 days prior to testing. You have an invalid test if you don't see a line in the control area. Even if you see lines in the test areas, or if the lines don't go all the way across the strip, if you see an invalid result, use a new kit to run another test. After you discuss test results with the client, dispose of the single-use materials in the appropriate waste containers. Discard the test strip, workstation, gloves, used alcohol swab, and used cotton gauze in the biohazard bag. Place the packaging for the bandage and other materials that have not come in contact with any bodily fluids in the trash bin. If there are any spills, clean up with a 10% bleach solution. Thank you for viewing this video on conducting a rapid HIV test using a whole blood finger stick sample. This video was developed by National HIV E-Learning Centers for the Centers for Disease Control and Prevention.